Hello, everyone. This is Lauren Steiner, host of the Robust Opposition. This coming week is the National Week for Medicare Expansion. And I'm here with a very special guest, Dr. Jessica Schorr Saxe, who is the chair of the Healthcare Justice North Carolina organization, which is a chapter of Physicians for a National Health Program. And she is also on the board of PNHP. How are you doing tonight, Jessica?
It's great. I hope you are.
Well, Dr. Saxe is also a retired family physician. So maybe I should ask you first to define what is Medicare expansion as opposed to what we've all been fighting for, Medicare for all.
Medicare for expansion, unfortunately, is not Medicare for all. But what we hope it is a step in a direction, and it is something that is politically feasible right now. Would be making improvements in the current Medicare program, and that would go into the reconciliation bill that's being discussed in Congress now.
Yes, and we know that Bernie Sanders, who has been the author of the Medicare for All bill, has not yet introduced his bill because his Medicare for All bill this time, because he's been working so hard on this Medicare expansion. And like you said, it is what is politically possible. So why don't we get right into it? Let's talk about the different components, because each day of the week is focusing on a different component.
There basically are 4 components. Let me talk about each of them and why it's important. So one of them that's been among the least talked about, but is possibly the most important, is putting an out-of-pocket cap on traditional Medicare. So I don't know whether all your viewers realize that for people on Medicare, there are 2 choices. And one is traditional Medicare, which is how the program was originally designed to be. And the other is Medicare Advantage. And Medicare Advantage goes through private insurance companies. Now, traditional Medicare has many advantages for the people who are on it, including the fact that they can go to any provider who takes Medicare. It doesn't have certain networks. But it has a big disadvantage compared to Medicare Advantage because Congress has not seen fit this far to put a cap on what out-of-pocket expenses can be. So in other words, somebody who signs up for traditional Medicare could get Medicare bills of, thousands and millions of dollars, which you can do in this country, and continue to owe on them. Now, many people, myself included, have what are called Medigap policies, and Medigap picks up the co-pays and some those out-of-pocket expenses. But not everybody on Medicare can afford to have such a policy. So if Congress would agree that traditional Medicare would have a cap, it would make it a more feasible choice for more people in this country, and it would make it more competitive with Medicare Advantage and allow people to take advantage of the advantages of traditional Medicare. Is that clear?
The major point is that we're trying to get more into the public paying for it than the patients paying for it, right?
Exactly. Exactly. We're trying to make people who might want to sign up for traditional Medicare not so vulnerable to just infinite out-of-pocket expenses, which are the kinds of things that are financially devastating and lead to bankruptcy and things like that. That's what we're trying to do.
It would make Medicare for all more palatable, because right now, it's surprising. You talk to people and they say, oh, Medicare is not so good. It doesn't cover this. I still have to pay for that. So that's why, Pramila Jayapal's bill is called the New and Improved Medicare for All Act. Okay, so what's the second major component?
Okay, so another major component that you may have heard discussed more, because it actually is in the draft of the bill and has been discussed all along, is making Medicare, improving Medicare so that it covers more things. Right now, Medicare doesn't cover hearing, vision, and dental. One of the things I saw today was somebody says Medicare doesn't cover heads, hearing, vision, dental, and it doesn't have good mental health care coverage. What's in your head? Well, the head is part of the body, including the teeth. They're all part of the body. And all of those things are critical to the people who are on Medicare. You know, seniors have trouble with hearing, vision, and they have trouble with their teeth. And so a second part of it, that would be a second part of it.
Yes, now already we know that the dentists are against this. I read a very long article, which I'll post in the comments in the New York Times about this dental coverage. Dentists are against this because they pretty much, because of the fact that dental has not been included, they pretty much have worked around it and they have their own dental insurance. I actually purchased it this year because I have to do, I'm being told, $15,000 worth of dental in my mouth for crowns, an extraction, which I already had to do, an implant, which I have to do, 3 root canals, and it adds up. But the best insurance I could get, Delta Dental's high policy, it's $600 a year. They only pay out a maximum of $1,500. So really all you're getting is $900. And, you know, it doesn't cover implants. It covers maybe 1 crown a year. It'll cover extractions and cleanings, and that's about it. And then, of course, the article shows how bad dental care or neglecting your teeth can also affect your body, including your heart. And not only that, you don't want to smile. I mean, if you can't afford dentures, they talk about so many people who are just so happy to be able to smile again. It's really sad. Now, the third component.
Control of prescription drug prices, including allowing Medicare to negotiate prescription drug prices. Medicare is not allowed to now because when the prescription drug bill was passed in the early 2000s, the pharmaceutical industry had a big lobby and they made sure that Medicare would not be allowed to negotiate. So everyone may know that our drugs are way more expensive than other countries. People spend like 2 to 4 times or more on prescriptions than people do in other countries. So Medicare can't negotiate prescription drugs, but the VA can. And the VA has much better control of drug prices. Now, the key thing about this improvement, and one of the reasons that it is really important to advocate for this and really important to get it, is that in contrast to everything else that would cost money, this would actually save money. And it's projected that it would save enough money that it would pay for the other improvements because the government and individuals would not be spending as much on drugs. So that's another key one.
Well, we know that already the government spends more than any other country, and we have some of the worst outcomes of the industrialized countries. And there's many studies which shows how Medicare for All, everything in Medicare for All, not just these improvements, everything of Medicare for All would be cheaper when you look at all the overall health expenses, not to mention how much we're going to save by not having to treat people that have preventable diseases that they're not preventing because they can't afford to see a doctor and do preventative health care. So what would be the final element of the expansion?
Okay, so the fourth is lowering the age of Medicare. And people talk about lowering it to at least 60 or maybe to 55. The advantage to that is that you have all kinds of people in that age group who've developed health conditions. You know, that's also a vulnerable group. And some of them are just waiting till they turn 65 to have them taken care of. It also would be helpful because sometimes people are reluctant to hire people in that age group because they think that their jobs, health insurance costs may go up. I mean, it would be a real advantage. Now, I would say that that is a critical one to do. We need, you know, as far as I'm concerned, we should be lowering the age of Medicare to improving Medicare and lowering the age to 0. That should be our target. However, I think it's really important to get the other improvements as well if we're going to lower the Medicare age. And of course, as I said, if we could negotiate prescription drugs, that would make lowering the age more affordable.
Yes, and politically, it's very important to get more people on Medicare, because the more people you have on Medicare, the more constituents you have to advocate for it. Monday is the day to talk about lowering the eligibility age. Tuesday is the day to talk about out-of-pocket cap expenses. Wednesday, the day to talk about lowering drug prices. Thursday, the day to talk about vision, hearing, and dental. And Friday, you can talk about all Medicare expansion policies. And the number to call in is 202-224-3121. And that will connect you with a congressional switchboard.
So everybody should be doing this and letting their members of Congress, both in the House and in the Senate, know that all of these things are important. As I said, expanding for dental, hearing, and vision are in the draft of the bill, but the bill is a draft and we want the other things put back in.
The toolkit also has some sample tweets that you can tweet at your representative. This is something that is very important to do. You'll notice that there are some naysayers on the purity left that are basically criticizing Bernie for not mentioning Medicare for all anymore, or AOC or Pramila Jayapal, all these people who have been champions, criticizing them, and instead going for this incremental change. Before you leave, Dr. Saxe, what do you have to say to those people on the purity left?
The purity left. I've never heard that term, the purity left, but
I just made it up.
that's great. But there's no greater supporter of Medicare for all than probably you or me, or I absolutely think Medicare for all is the way that we need to go. And I'm very aware that this does not change our current system completely. It does not get us to Medicare for all by itself. But for many reasons, I think that this is a step in the right direction. I think that this will improve Medicare. So just like you said, Lauren, it'll make it more popular so that you won't have as many people saying, well, I don't know about Medicare for all. I don't like my Medicare. I think people like their Medicare a lot better. I think other people will see that they like Medicare. And I also think that this will keep the issue of our need for better healthcare and better access alive. I think if we don't support this, and it doesn't happen, I think the issue is likely to be buried under all the other things happening. So I feel very strongly that these are steps in the right direction.
Right. And I'll just add for the purity left that anything incremental provides material benefits to tens of millions of people. And for someone to try to deny those people those benefits, they must be coming from a very privileged position. And I know most of these people are not privileged, but they should see how privileged their position sounds. Maybe they can afford to wait it out, but these people can't. And if we can provide them with help, I mean, after all, the reason we got into this healthcare justice is to provide healthcare to people. And really, at the end of the day, what the bill is, doesn't really matter. The idea is to get people healthcare as a right, not a privilege.
Very good. I agree.
So thank you very much, Dr. Saxe. I'm going to let you go so I can promote my show tomorrow.
Thank you.
So I would like my viewers to call their representatives tomorrow. Make sure, you can call one action a day, or you can call every day, out of order, whatever you want to do. I'm just going to be posting the toolkit, which shows what the day's actions are to be, with some talking points and some sample tweets if you're on Twitter. But you know that the Physicians for National Healthcare Program is hardly a bad faith actor. They're not, as Bree Gray called them, the institutional left. Well, maybe they are the institutional left, but they are an institution that certainly has people's best interests at heart. They are not bad faith actors. And if they can be supporting this, along with National Nurses United, another organization who's been pushing for Medicare for all since day one, then you know that this is what we have to do to help our cause politically and also to help a lot of people materially. So tomorrow night, I'm going to be discussing the recall in California. Can Democrats stop the Newsom recall? I'm going to be having some friends of mine who are part of the Democratic Party, Progressive Democrats, on to discuss the issue. And that will be at 6 p.m. Pacific time, 9 p.m. Eastern time, if anyone on the East Coast is interested in watching. But share this brief show or extended public service announcement and keep fighting.